And welcome to The Balancing Act. I'm Olga Villaverde.
And I'm Untitled Williams.
Today, we're going behind the mystery of uveal melanoma.
And we're also going to be talking about ways to help those with COPD.
The Balancing Act starts
right now.
For the 30 million adults in the United States living with chronic obstructive pulmonary disease, or COPD, day-to-day activities can be a big struggle.
Yeah, and we'll be hearing from Dr. Raj Dasgupta on how patients can manage their disease.
But first, let's meet Chuck, once an avid golfer who is able to pick up his clubs again thanks to full cycle breathing technology. That's great news. Take a look.
I grew up in South Florida, retired from the banking business, moved up to Claremont here with the idea to play golf every day. We have friends here that we barbecue, go out to dinner with, things like that. Always had asthma as long as I can remember. I was in and out of the hospital a lot as a child, and it got worse towards about 50 years old. They diagnosed me with COPD. Then I went into emphysema, and my quality of life deteriorated quite a bit.
When we talk about here in the United States, almost 150,000 people have died and suffered from COPD. It is a chronic respiratory disorder. It's about severe airflow limitations, meaning they can't get air in, and when we talk about obstructive lung disease, they really can't even get the air out. They could have fatigue, they could have weight loss, cough, mucus production, shortness of breath, and of course, especially if there's an asthma component, wheezing. So depending upon the severity of COPD, it can definitely affect things at home, things at work. It definitely affects your lifestyle. Multiple admissions to the hospital and the emergency department. And needless to say that besides the organs in the body, talking about the heart, talking about the effects on the lung, it can definitely cause depression. It can cause anxiety. It can cause people to be isolated at home. So COPD can take a toll on every aspect of a patient's life.
Well, the COPD was just a word to me until it started affecting my life and as to what I could do. I would run out of air much faster. My condition kept progressing, and I had a lot of infections and flare-ups. Then I started with the various bouts with pneumonia and that in the hospital.
As his condition continued to progress, a new reality for Chuck set in, using supplemental oxygen 24/7.
I still tried to play golf and did play golf. I cut down the number of days. I played golf for 2 years, and then I went through my final 2 big bouts with infections and pneumonia in the hospital, and I had to quit golfing. Was able to get around a little bit. I mean, we did do some card playing. That's pretty much all we did. A little chess now and then. Well, it's kind of depressing to go immediately into fairly active to not doing anything at all. I needed to do something to get better somehow.
So the key part is, after they get the diagnosis, is to have shared decision making. Make sure I understand what they want to accomplish, what are their limitations. And I feel that after they get this diagnosis, in most cases, they shouldn't have to change their lives. They could still go out and see their friends and see their families. If they want to do simple things like going to the grocery store, this can be done. And especially now that we have many new options to offer different people at different stages of the disease, this is something where people could have a positive attitude going forward carrying this diagnosis. So when we talk about COPD and treatment, one of the most important things to start these patients on is pulmonary rehab. They help you exercise. They help you understand your disease state. They help you understand the breathing techniques, because there is data that patients who are sedentary will have a higher risk of infections, have a higher risk of exacerbations. So encouraging movement is one of the core things I promote in my COPD patients. And for patients who have multiple exacerbations, I'm very happy as a clinician that there are medications to reduce these exacerbations. And unfortunately, many of my patients may need supplemental oxygen.
As COPD progresses, the muscles that support natural ventilation have to work harder.
Full cycle breathing can help patients both breathe in more oxygen and then expel CO2, giving those fatigued muscles a rest.
Thus, less shortness of breath and more energy to remain active.
There's a certain stage where patients can't keep up with their own ventilatory needs. And when this happens, they need assistance. And this can be done in two ways. It can be done invasively, where unfortunately there are individuals in the ICU that have a tube past the vocal cords. We also have non-invasive ventilation through an interface such as a mask, whether it covers the nose or the mouth and nose. And it's amazing when we talk about the non-invasive, there are devices out there that can help patients with COPD be mobile. And that's always going to be a very important part.
Even with oxygen, you're still going to have difficulty breathing. At least I did. So I talked to the doctor. I says, is there anything else I can do? Rid of this tightness in my chest all the time. And they said, well, the best thing for you then is to get you into a breathing machine. I was thinking to myself, oh boy, you know, I've got to wear a breathing machine. And well, it turned out that wasn't it at all. So the Life 2000 came around. Well, the trainer came out right away and hooked me up immediately, showed me how to use it. It's very easy to use, really it is. Glad it doesn't have a mask. The nasal cannulas they give you have a pillow interface, so they're even easier to use than this thing. Makes it very comfortable. With the Life 2000 on, I can walk a lot farther. Play some golf, of course. I'm getting to play more and more holes. So it's really great to know that you've been released from this prison, you know. You're able to actually get out and do something. And if I hook it to the portable tank, we do our walking with that. Really nice to be able to get some exercising in. You know, you get to where you're not exercising and just watching TV all the time. It's bad for you to do that. So increases the quality of my life.
So the Life 2000 is a non-invasive machine that allows a patient to be mobile. And in fact, it's not really a mask. And I think that's gonna be very important because, hey, what's the point of going out if you can't eat and talk and do the things that make you happy? You know, I've been working with Hillrom for a while, and I just feel that they really do care about their patients. One of the things that gives me comfort is that I know that Hillrom will provide some supportive staff, because it can be overwhelming when you have a device. So to know that they spend time with the patient to explain it, this gives me a little reassurance that, hey, if I recommend this device, that my patient will actually know how to understand it and get the maximum benefit from it. And when we talk about a device that's a portable ventilator like the Life 2000, they can walk longer, they can exercise more. And exercise, social interactions, really helps out patients with COPD. So any device, such as the Life 2000, that may help patients go do these things, hey, that puts a smile on my face.
Oh my gosh, it was really quite a difference. It was very exciting because he could do so much more. He could last so much longer. You know, with the things that he was doing. We were in a lull for a little while there, and then we got the Life 2000, and that brought us back to what we were doing before. It's really improved our lives a lot. It has.
If you have COPD, speak to your doctor to see if the Life 2000 system is right for you.
And for more information, you can always visit thehillrom.com/Life2000, and of course, visit our website, thebalancingact.com.
Melanoma is a type of cancer commonly known to affect the skin. However, melanomas can also occur elsewhere in the body.
Today we'll be exploring uveal melanoma, which accounts for only 4% of all melanomas, with approximately 2,000 Americans being diagnosed every single year.
We're going to start with Lindsay in Denver, Colorado. Let's go behind the mystery.
And at that time he said, yes, Lindsay, this is extremely serious. You have a tumor actually detaching your retina. You have eye cancer. after college, my high school sweetheart, Paul, and I moved to Colorado to begin our life together. And we have 3 kids, 8, 10, and 12. We are always on the move, doing a variety of different things, constantly cheering on the kids in a variety of different activities. We're also always planning and looking forward to our next adventure. So I started experiencing symptoms when I was 34, and the symptoms I was experiencing was blurry vision. I just assumed, oh, I need to get, some prescription lenses. But one morning I woke up and had this gut sensation that something was truly wrong. So I drove myself to the ER, and at that time I was diagnosed with a detached retina.
Lindsay was sent to a retina specialist who performed a dilated eye exam, which showed the cause of her detached retina and diagnosed her with uveal melanoma.
I remember just falling to the floor. I couldn't process life. I couldn't process reality. And I remember just praying that I would wake up the next morning and my children would have their mom.
We're at Sidney Kimmel Cancer Center in Philadelphia, Pennsylvania, to meet with medical oncologist Dr. Marlena Orloff.
Uveal melanoma is a rare subtype of melanoma. It is very different from skin melanoma, and it typically affects the tissues of the eye, including the choroid, the ciliary body, and the iris. Despite very effective treatments of the primary eye tumor, about half of patients will recur with metastatic disease, typically to the liver. Patients can present in a couple different ways. Some patients have a freckle in the eye, and a number of patients present with visual disturbance. This could be cloudy vision, loss of vision, and flashes and floaters, often related to an associated retinal detachment. Since many patients with uveal melanoma have their eye melanomas diagnosed on routine eye exam, not having had any symptoms, this speaks to the importance of getting an annual dilated eye exam by either an optometrist or an ophthalmologist. While we don't know what causes uveal melanoma, we are aware of a number of host risk factors that may increase one's risk of developing uveal melanoma. These include Caucasian ethnicity, being of Northern European descent, fair eyes, light skin, and a very rare hereditary syndrome called BAP1 syndrome.
I was in a really, really bad spot emotionally. All of a sudden I hear I have cancer, and then I find out that I have the most aggressive form of this cancer.
After Lindsay's diagnosis, she was referred to an ocular oncologist, Dr. Peter Hovland, who outlined treatment options and scheduled her for a PET CT to test for metastatic disease.
The good news came back that I had no metastatic disease, but it really put a lot of emphasis back on the eye. And so I chose to do proton beam radiation. I then travel for my treatment, so I'm away from my family. So initially after the proton beam radiation, we were really hopeful. We were seeing signs of the tumor shrinking. Unfortunately, I had lost all sight at that point. So ultimately, my mind went to a really, really dark place, just processing what it was gonna be like, or what my future was gonna be like, or even if I had a future.
Once uveal melanoma is suspected, patients should be referred to an ophthalmologist with an expertise in ocular oncology. Due to its rare nature, patients should be referred to a specialty center. Once evaluated by an ocular oncologist, they will make the diagnosis and discuss treatment options. These treatment options may include plaque radiation, external radiation, such as proton beam, or enucleation, which is removal of the eye.
For about 1.5 years, I managed lots of radiation side effects. I was begging my doctors to remove the eye as soon as possible because the pain was so excruciating at that time. And we actually saw signs of the tumor regrowth. As much as I processed and thought I prepared myself for losing an eye, no one can prepare yourself for what you will go through. And ultimately that waiting game for the 6 to 8 weeks until my prosthetic was made to actually, want to look in the mirror again and to see myself.
Coming up,
Dropping to the ground again because this was the moment that I had prayed for 4.5 years would never come.
Welcome back. We're discussing uveal melanoma. Let's go back to Dr. Orloff to learn more about metastatic disease.
After diagnosis and management of the primary tumor, patients should be referred to a medical oncologist to discuss options of surveillance. This can include MRIs, ultrasounds, and CAT scans to monitor for metastatic disease. Your doctor may obtain a small biopsy of your primary tumor to send for a genetic risk profile. Information obtained from the genetic risk profile will aid us in tailoring a specialized surveillance plan to monitor for metastatic disease. Once the metastatic diagnosis is made, there are various treatment approaches, including liver-directed therapy, immunotherapy, and clinical trials. Historically, the prognosis for metastatic uveal melanoma has been poor. However, just over the last 5 years, we've had more advancements in uveal melanoma than we had had in the many decades before. There have been advancements in the basic understanding of the disease, the epidemiology, and potential treatment options.
I always said since the beginning, if I only lost my eyesight, or if I only lose my eye, I'm gonna be like the luckiest person in the whole entire world. Unfortunately, at about 4.5 years, I got the report I prayed would never come in, metastatic melanoma in my liver. Dropping to the ground again because this was the moment that I had prayed for 4.5 years would never come. And it was there. And at that time, I again worked really closely with my oncology team, and we collaborated with other oncologists across the country to ultimately decide what was going to be the best treatment for me to ultimately treat those tumors.
I'm hopeful for the future that we'll continue to expand our knowledge and be able to provide better treatment options for our patients. We've now developed 2 different types of registries to help further this effort. One is what we call an academic registry, or a registry where physicians put in the information, and the other a patient registry where patients can enter in their own data. The uveal patient community is amazing. They engage with each other, they engage with us as physicians, as researchers, and we can all work together towards finding better treatments for this disease.
So I am a big advocate for the Melanoma Research Foundation and also Cure-OM. This foundation has ultimately been with me from day one. Not only me, but really my family, and supporting us from day one and connecting us to different support groups, connecting us to, my ocular melanoma, uveal melanoma friends here in Colorado. Also their different walks, their annual galas that they host, really a big believer in supporting those events and those foundations to raise the critical funds to fund the research. I think our family loves to continue to be social and to get out and enjoy the outdoors, and really try to make sure that my disease isn't limiting me long term, and cherishing every single moment, because we never know what any day is gonna bring. I've always said, if there's options, there's hope. And ultimately, I've always had options, and that's always provided me a lot of hope. And the more options there are, the more hope that it can provide, not only to myself, but to the whole uveal melanoma community.
For additional resources and support on uveal melanoma, visit these advocacy sites.
And as always, you can visit our website, thebalancingact.com. Well, thanks so much for joining us today.
Remember to head to our Facebook page, like us on Instagram, follow us on Twitter, and visit thebalancingact.com to enter our latest sweepstake or giveaway. You never know?
You never know. Make sure you stay safe, take care of the family of yours, be well. We'll see you next time.